estamos listos. Hello. Ya estamos. So hello. Good afternoon. So we have a very nice case today. I was missing to have our live transmission in our YouTube channel, but we had a lot of work during last time, so I didn't have time to be with you. But today we have first a very nice case. This is a big tumor, a big mass. I am working. I have the pleasure to work with Raquel del Valle, Dr. Raquel del Valle. Very nice U.S. endoscopist. So she's showing us the gallbladder of this patient. This patient have history of weight loss and jaundice, and MRI show with a mass that were not very well understood. And what we see here is that this mass is coming from the gallbladder. This is the gallbladder here, and this is the mass inside. But this mass is also occluding the biliary tract. And we will show you the radial image. Podemos ver las imágenes del radial. I can show you the US image. So this patient unfortunately have liver metastasis also. So we have here, this is the biliary tract. You see here the tumor, very clear, very nice explanation of Raquel. I will click to see bigger the image. So you can see here the invasion of the lesion. You see here to the biliary tract, and this is the tumor. You see here the tumor is a big tumor. So there is no vascular invasion. However, the main biliary duct, there is a big invasion here. You can see here. So this is a gallbladder tumor. So unfortunately, this patient have metastasis, liver metastasis. Podemos ver las metástasis? So so we can offer just a palliative. This is a nodule in the liver. You can see here the liver metastasis. So we already do it biopsy from fine needle biopsy. Déjame mostrar. Fine needle biopsy from the liver, from the nodules, the metastasis, and from the mass. You can see here the fine needle biopsy, very well performed by Dr. Del Valle. Very good tissue. And now I want to see what kind of treatment we can offer to this patient. For sure he needs chemotherapy, but now I need to solve we need to solve the biliary tract problem, the jaundice and obstruction. So now we will change. I will show you listo, cambiamos de tubo. So I will show you the shear wave of the lesion. So here is a hard tissue. You see here. So it's in mean 9.97 in 10 kilopascal of the mass. You see, so it's the elasticity is very hard tissue. So now I will try to see if I can do a standard ERCP and try to see inside. I want to see what is going on, and make a solution for him. So the idea now is try to reach the biliary tract. I will pass a cholangioscope. I want to see inside, uh, if it's possible, and if not, if it is not possible, I will try to perform a drainage by US. But I always try to do in this case. I believe it's possible to reach the biliary tract. So the second thing is very important, is to see sometimes this patient have bleeding. You see, and this patient is bleeding from the papilla. So so this confirms my suspicion of biliary tract invasion. Necesito las imágenes de la fluoroscopía, ¿no? So I believe I am inside now. Uh-huh. So let's see. Okay, this is the main pancreatic duct. What I will do is less guide wire there, and then I will use a second guide wire. Dame otra de aquí. So I want to tell you that the registration for our live course in May is already open. So I want to invite you to register in our live course. This year we will have very interesting technologies. We will have a very nice hands-on with 15 stations, and we will work with Apollo. We will show you how to use suture in practice, and how to use new devices as Limaca needle, that is motorized needles in the US. We will show you how to do how to perform axios, for example, and we will show again endosound, mixed reality monitors. So it will be some. This will be the second course with immerse technology. So you will have the possibilities to be in the room, in the operating rooms, in two of our operating rooms, from the audience. That will be very nice. And we will show you the new platform from Pentax Medical, for example, the Inspira technology, that is 2K scopes and much more. So please, we just have a space for 1,000 physicians. So if you want to be with us, it's time to perform the registration. And a big number of faculty, local faculty and international faculty that will be here, and we will do a live transmission from all our centers. Retira un poquito. I'm trying to reach the main biliary duct. Retira un poquito. Oh, it's here. Hazme zoom, por favor. Sí. You saw? So what I do is to inject a little bit the biliary tract. I saw the contrast going inside, and then I try to put my position there, and I do a small rotation of the guide wire with the fingers. When you do that, you arrive to a keef and pass inside. So now we have here. I will inject. You see here the mass destruction, and I will use a 9 French cholangioscope, I believe, if I arrive to do it. If not, our 7 French. You see here, see the quantity of bleeding that is going out. So this is a big tumor, huh? Okay, so now I will perform empuja. I will cut here. I want to see the extension of the tumor. I already see a little bit. So I do the sphincterotomy now, and I will pass my my cholangioscope here. Tenemos un stem pancreático biodegradable. So I will let I will let a stent biodegradable stent in the pancreatic duct just to avoid pancreatitis because of the manipulation of the main pancreatic duct. So I will no. Sí, IMAX. Bueno, dame el stand, dame. I will less the stand first, just to have more. Yes. So I will pass the stand now, okay? So I will less a biodegradable stand. This is Archimedes stand. So thank you to AMG to be part of the training center and help us. My friend Onur. Thank you, Onur. Huh? It's a Primus Medical distributor in Ecuador, right? So we just sent a study to DDW this year, a prospective randomized study that showed that there is no difference regarding plastic stents or biodegradable stent for avoid pancreatitis during ERCP procedures when you perform manipulation of the main pancreatic duct. So the big advantage is that it's not necessary to come back to remove the plastic stent. So it's very interesting, and this support that this new technology could be used in our patients in a daily practice. So now you can see there I am putting the stent. You see here, and you can see by fluoroscopy very well. So now I am perfect there. Silver. So you can see here the stent was delivered, and now I will start to work in my very track. I'm just trying to okay, perfect. Wait moment. I try to okay, let's go. So I pass a 9th range cholangioscope. I believe will be possible to do it. So you can see the plastic biodegradable stent in the main pancreatic duct, and I believe because of the bleeding in this patient, I will use a metallic stent in the rear tract. And what kind of a stent? I believe this is very important. So my chief has arrived. My chief arrived, huh? So this is a very nice point. What kind of a stent? So I will say if this patient is not having an anemia or bleeding like I saw in this case, I will use uncovered stent, but because probably the life expectancy of this patient is really low for in 6 months, but because of no, it's not passing, huh? So I want to see inside, huh? But I believe I will use a fully covered stent or partially covered because of the risk of bleeding through the stent is high. So this will help to avoid anemia or then. Come on. Trying to see the cholangioscopy to guide myself, but a little difficult. I think it's invasion here also. Can I? It's not passing. No, necesitamos dilatar. So I will make a dilation, balloon dilation now. Sí. We need to perform a balloon dilation because there is a stenosis down. So I will use now a Boston Scientific balloon dilation. What we have now? ¿Qué tenemos? Hurricane? Hurricane. Thank you, Boston, for being partners of the training center. So I will show you. I love this balloon. It's a very good balloon, huh? Thank you. I'm here with Clever and ¿cómo se llama? ¿Cómo te llamas? No, ¿cómo se llama tu amiga? Angie. I'm here with Angie, the best friend of Clever. The friend. Friends forever. Okay, dilata. So now we'll perform the dilation with the balloon. Dilata todo. You can see the stenosis there. Todo dilata. So we are doing a very good dilation. I will provide that I have here the balloon and I will perform a dilation inside just to see if we can arrive to pass the 9 French cholangioscope. You can see the balloon. En grande la rayos X, por favor. Perfecto. So now desinfla and I will perform a balloon dilation from inside. Dilata ahí. Todo. Perfect. Desinfla. Dilata ahí. Perfecto. Okay, il pass. Perfect. Desinfla. So now we'll remove the clots. That's very good. You see the clots coming out That's very good. Okay, now we're ready. Okay, now perfect, 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 perfect. Now we're inside. See? Colangioscopía. Imagen en grande del colangioscopio. So now we see here the tumor invasion very well. So it's less probably that that the this is very clear to see. I want to show you. You see the epithelium. So here you see the ulcer, and this ulcer is because of the invasion. Because when you see the surface of the biliary tract, you can see very well that there is not this papillary projection or distortion of the biliary tract. You see in the middle circle to the left, you see very well that is perfect the surface, and the surface in front of is also perfect. Is you see? And this showed me that this tumor is not coming from the biliary tract. Well, no, it's not coming from the common bile duct. It's coming from the gallbladder with invasion to the biliary tract, and this is why the bleeding of the biliary tract is happening. Now I am here. So I believe I will use, you see, this is extension, so there is not, it's not a problem inside. So I will use a metallic fully covered stent. Ponme contraste aquí. Yes, I will use contrast. I want to see very well. And we cannot see the cystic duct. We cannot see the cystic duct, so it's because of the okay. So now let's see. This is the right branch. Wait. Oh. Okay. So now. Okay. ¿Inyecta contraste? Sí, obvio. Esta es la guía. Quiero jalar. Ok, jala la guía. Sí, necesito ver la bifurcación. Sí, estamos bien. So we have a space, huh? We have a space. Empuja la guía. Empuja la guía. Sí, sigue, sigue, sigue. We have a space, and I want to show you very well the very track here. You see here. So I believe it's we have a lot of space here. So unfortunately, this patient have already metastasis, so it's not chance for any kind of surgery. Picture. Okay, empuja. Now we will put a metallic stent, fully covered. Totalmente cubierto, sí. A ver. So now. Okay, empuja. Empuja, 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 empuja. Empuja. Sí, 18 está bien. Send by 8. I believe will be perfect. F, totalmente o parcialmente. Lo que sea. So now we will use a fully covered metallic stent from Microtech. And I believe we will finish in a few minutes, okay? So now you can start to open. I'm in a very good position now. Abre. Cuidado. Sigue. Un segundo, retrocede. Recógelo de nuevo. So, now, ahora sí, comienza a abrir. Sigue. 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 Dame un segundo. Necesito retirarlo un poquito hacia afuera. Now I will make a stem reposition. You see here? Oh. Okay, abre. Abre, 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 abre. Abre todo. Abre, 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 abre. Abre, 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 abre. And the stand was very well placed. You can see now. And I finish my procedure. So this is the way how to deal with this kind of lesions. I don't have any doubt about the malignancy of this tumor because of the characteristic, and you can see here all the contrast going out. It's very important to see to remove the contrast in the patient to avoid cholangitis. You see here there is air in the biliary tract. Podemos poner en grande la imagen de colangiografía. Colangiografía. Rayos X. You see very well the air in the biliary tract, so I finish. So thank you so much. See, see you in the next case. Thank you so much.